Hello everybody, my name is Dr. Asa Frey with Clinica Back to the Garden PR, which is a residential health and education center located in beautiful San Juan, Puerto Rico, La Isla del Encanto. If we have never met before, again, my name is Dr. Asa Frey. I'm co-founder and co-director of Clinica Back to the Garden PR. This is a residential health and education center, so we specialize in physician-supervised water-only fasting. We have a specific residential center where people come and stay with us while we monitor their fast to make sure everything progresses like it should and everybody's safe, and we get to watch them get well. We focus on chronic disease reversal. Chronic diseases are anything that range from hypertension and heart disease to diabetes, certain types of cancers, as well as many autoimmune conditions, rheumatoid arthritis, ulcerative colitis, psoriasis, any kind of inflammatory joint disease, many other things like Hashimoto's thyroiditis or thyroiditis, and a whole spectrum of other autoimmune conditions. Again, if you've never met before, my name is Dr. Asa Frey, and today we're going to be talking about water-only fasting. So today is more of a Q&A for you guys to ask your questions. So if you have questions about fasting, or if you know someone who has questions about fasting, or if you know somebody who's trying to do a fast on their own, they should probably tune in and ask the questions that they want to ask. I've kind of compiled a list here of common questions that you guys have been asking me throughout the past few months, month to 3 months of questions. And there are many questions that are the same. So I wanted to clear some things up and answer some really, really popular questions today. Okay, so if anybody has any questions before we begin, please let me know what they are. Otherwise, let me know where you guys are from. We got 15, 20 people here right now. Let me know where you guys are from. I see Ali's here. Hello, Ali. How are you? Hola, Alma Molina. Saludos. Bienvenidos. So tell me where you guys are from. Alejandro comments on pretty much every single one of our posts. You're welcome, and we certainly appreciate your gratitude. So thank you. And yo espero que tú puedes entender inglés, Alejandro, porque yo voy a hablar completamente en inglés hoy. Si tú puedes venir aquí para ayunar, then quizás podemos a dar una charla completamente en español para usted, okay? But today, just English. Palm Beach, I believe that's in Florida, but there's probably 1,000 Palm Beaches in the world, so I think that's Florida. Carmen Valentin, how does your diet work? That's a good question. That's not a fasting question, but I can definitely answer that really quickly before we start. So, at Back to the Garden, we don't recommend a diet, okay? We don't recommend a diet. What we do is identify causation. So, patients usually come to us and they are looking for something, right? Saludos, Naples, Florida. Thank you. Palm Beach, Florida. Yes, fantastic. So patients are usually looking for something. They're looking to get well. They have an autoimmune condition. They have skin issues. They have pain in their muscles, joints, tissues, systemic pain maybe. Maybe they have Hashimoto's thyroiditis that they're looking to stop the autoimmune reaction so they can feel better and function better. Maybe they have lupus or Sjogren's syndrome or rheumatoid arthritis. Maybe they have diabetes, right? They're looking to normalize or improve their blood sugar levels, maybe decrease their medication. Maybe they have hypertension and they're looking to lower their risk of dying, right? They don't want to have high blood pressure because that increases their risk for all-cause mortality. Maybe they have heart disease, maybe they have clogged arteries, maybe they're looking to clean up. Maybe they just want to feel better, right? Maybe they want to lose some weight. Maybe they just want to take some time for themselves. Maybe they think they need more time to recuperate, take some time, build their health up from the ground up again. How can I get some info to program a trip to your place to detox our bodies? Elizabeth, I'm going to talk about that in a second. Okay, first I'm going to answer, whose question was it? It was Carmen's question about our diet. So again, we don't recommend a diet. What we do is identify what is causing your lack of health, and we look to address the cause of the issue. Okay, so we do a complete history, we do a physical exam, we order the appropriate laboratory tests in order to identify what is causing the issue, and then we address the cause. Now, sometimes fasting is perfect for addressing the cause of the problem. Sometimes it's not. Okay, but we need to address the cause. Diet. So again, we don't do a diet here. What we do after a person has gained their health back and is really well and feeling good and functioning very well, then we teach them what they need to do. We teach them whatever it is that they need to do to maintain their health in the long run, right? So they can really become their own doctor and they can get control back of their own health. I hope that makes sense. So towards the end of the program, we are going to educate a patient about what kinds of foods they need to eat in order to maintain their health. Right? There are many other causes of illness or of diseases or of the people's problems, health problems. But as far as diet is concerned, there is an optimum diet for humans, and it turns out to be a whole foods, plant-based diet. That's whole foods, actual food, not processed food, and almost exclusively made from plants. Okay? So this is a diet that is made from lots and lots of fruits and vegetables, raw and cooked, raw vegetables and raw fruit, raw vegetables and cooked vegetables, as well as a moderate amount of complex carbohydrates. These are things like potatoes and sweet potato, malanga, plátano, pana, rice and beans, different kinds of beans, lentils and quinoa and other types of grains. Whole foods, though. This is a whole foods, plant-based diet. So, the diet works because it's the optimum diet for humans. It's not a special diet for decreasing inflammation. It's not a special diet for normalizing blood sugar. It's just getting people to eat a healthy diet. Carmen, I hope that makes sense for you. Okay? So, there was another question here. Let me see what this was. Saludos. Saludos, Palm Beach. Yes. Okay, how can I get some info? Okay, what you first want to do, if you guys want information about coming here to do a fast, then please visit the website first. It is in Spanish. If you can go to Google Translate, you put the website right into Google Translate and you get an English version of the website. It's pretty easy. Read the information there. There's a section on fasting in our residential center. So go there first, read the information. If you really have more specific questions and you're ready to schedule, maybe ready to have your initial consult, then you want to call our office or email us at backtothegardenpr@gmail.com. Okay? Everybody gets an initial consult. So whether you're planning on fasting or you don't think that you can come and you want us to sort of work with you on a long distance basis, everybody gets an initial consult so we can do the appropriate history, do the appropriate a detailed history, and then analyze all the laboratory results and see what we can do. Hello from Mexico City. But first, go to the website, read that information. Okay? Okay. So, again, anybody else with questions? I have a list here that I'm probably going to go through right now. First, I'm going to get a drink of water. And I'm also going to share this on my page. So give me 1 second. Again, hello from Mexico City. We see many people come here from Mexico and from Florida. Hello, Miami, Florida. Fantastic. Okay, so let me refresh this. I'm just going to share this on my page real quick. And guys, think of more questions because I have a list of about 4 or 5, but if you guys have more detailed questions, please let me know. Good morning, Janice Chico. How are you? Okay. Just sharing this very quickly. Share. If you guys don't know, we're going to be speaking in Ohio at, I guess, in about a week on the 28th, 29th, and 30th of July. We'll be speaking at the National Health Association. This is an annual conference they do every year. This year it's going to be in Cleveland, Ohio. The National Health Association is an association that is really founded upon the principles of healthful living. We believe that in order to live, to be healthy, we need to practice healthful living. And so the doctors at this conference are people like Dr. Joel Furman, Dr. Joel Kahn, Dr. Frank Sabatino, Dr. Alan Goldhammer, Dr. Pam Popper, as well as myself and my wife, Dr. Jayana, will be speaking there. If anybody's interested in attending that conference, please visit healthsciences.org and sign up for the conference there. There's not a lot of space left. This is going to be a very full, packed conference. Okay, so I can read your questions a little bit better down here, so I'm just going to look at them on my computer and if there are any others. But today we're going to be talking about, this is a Q&A on fasting. And we're talking about water-only fasting, okay? Water-only fasting is exactly how that sounds. It's with water, right? There are no additions that we make to the water. It's just pure, clean, distilled, or reverse osmosis water. We don't add juices. If you add juices, that would be juice fasting. If you add food, you get into things like intermittent fasting and sustained fasts. But a water fast is completely different. So the first question that I usually get is why? Why should I do a fast? Okay, usually people come into the office and we sit down and I ask them what they want and why they're here, and they give me a list of things that they're trying to improve, and then I ask them if they're interested in doing a fast, and many times I get a question like, well, why should I fast? There are just so many reasons to do a fast, okay? Maybe you want to achieve an ideal weight. Maybe you want to decrease the amount of systemic inflammation in your body. Maybe you want to decrease the amount of pain that you're having from chronic pain syndromes or fibromyalgia or rheumatoid arthritis. Maybe you want to address a specific condition. Maybe you have diabetes. You want to normalize your blood sugar. Maybe you have hypertension. You want to normalize your blood pressure. Get off those dangerous medications that you're taking. Maybe you have high cholesterol and you want to decrease the amount of cholesterol in your body so you can also decrease the amount of risk for heart attack and stroke. Maybe you just need a rest. Maybe you just need to take a rest. Maybe you haven't really given yourself the gift of resting and you're worn out. Maybe you want to stop having to drink coffee every morning in order to have enough energy to get you through the day. Maybe you want to wake up with a fantastic amount of energy and maintain that throughout the day. Maybe you just want to improve your health. Maybe you just want to do a yearly fast in order to clean up and restart and really adopt and adapt to and maintain a healthy diet. And fasting can help with all of that. There are just so many reasons to fast. But most people are usually concerned about a specific condition. They say, is it safe to fast with my specific condition? Is it safe to fast with diabetes? Is it safe to fast with rheumatoid arthritis? Is it safe to fast with ulcerative colitis or anemic patients or a variety of conditions? So there's a small list of people who are really not good candidates for a fast. And that list starts out with people who have diabetes type 1, who really are not producing a sufficient amount of insulin. You need a very small amount of insulin to be produced in order to keep someone safe during a fast. So type 1 diabetics are really not good candidates for fasting. However, they are very good candidates for adopting and maintaining a very, very disciplined whole foods, plant-based diet, a diet that's extremely high in fruits and vegetables and does not contain any processed foods such as oil, salt, sugars, or flour. What we want to do with a type 1 diabetic is really increase the sensitivity of their body to the insulin that they have to inject. And this decreases the amount of insulin that we need to use, right? So getting on a program, which we also do here at the clinic, we do have patients that come and they don't fast. Maybe they're on a juicing program or a specific dietary program. And we'll monitor them through that program as they decrease the amount of medication that they are required to use. And that's not a confusing process. It's actually quite simple. With diabetic type 1 patients, you do need them to eat a certain amount of calories during the day so they stay out of ketosis and they don't go into diabetic ketoacidosis. However, with a very disciplined, strict dietary program, as well as the addition of rest, right? All of our bodies require rest, and if we're not getting enough rest, you're going to see very little progress in your improvement of whatever specific condition, especially diabetes type 1. So diabetes type 1 should not fast. Pregnant patients should not fast. Patients who have chronic advanced kidney disease probably are not good fasting patients. However, in order to figure out if you're a really good fasting patient, it does require a skilled physician to do a physical examination, to do a detailed history in order to make that decision whether fasting is right for you. Janice, should a person only water fast under medical or expert supervision? Well, that's a great question. I'll give you kind of an analogy here. If you have a problem with your teeth, right, you'd want to go see a dentist, right? And you'd want that dentist to do whatever he needs to do in order to address the cause of the issue, right, with your teeth, whether you have a cavity. Let's say you have a cavity, right? You wouldn't go about trying to fill your own cavity or give yourself a root canal, right, or whatever other kind of procedures they do in the mouth. You'd want a skilled dentist specifically to address those issues because he has the training in order to do it correctly and to do it safely and effectively. I hope that makes sense. So, fasting, there can be complications during a fast. Many times there are complications during a fast. However, if you are under the supervision of a skilled physician who has experience in water-only fasting, in directly supervising water-only fasts, then you can avoid the majority of those complications well before they even begin. Okay, so that is because of the specific history, the detailed physical examination, and the appropriate laboratory tests, and the direct daily supervision. So this is daily supervision where a doctor comes in and puts his hand on your pulse, and he checks and he feels that pulse. That is what it takes to maintain a safe fast, especially for more than a few days. Many patients do want to fast on their own, and they ask me if it's safe for them to fast on their own, or under the supervision of a physician or a nurse or their friend or some other medical doctor, and someone who doesn't have the experience in supervising fasts. And I'd say this is probably a bad idea. fasting supervision is not something that physicians or doctors learn about at school. This is just not something that is taught at school. You really do need to do an extensive period of education and practice afterward in order to gain the education and the confidence to keep people safe and to keep a controlled and perfect environment for fasting. All the doctors at Back to the Garden PR are certified by the International Association of Hygienic Physicians. This is an association which certifies doctors for fasting supervision. Okay? My wife and I were both there for about 6 months, living at a facility where everyone is fasting. So in the morning, we live on this facility where everybody is fasting, and we go around and we check about 30 to 50 fasting patients per day, twice a day, every day. And we do that for a very long period of time so we can gain the experience that you need in order to do this type of work correctly. Naturopathic doctors, chiropractors, medical doctors, osteopaths, nurses, they do not get this training in school. Okay, so it really takes an extensive amount of training after professional school in order to gain the experience that is necessary. Okay? Now, having said that, fasting for maybe a few days is probably a safe thing as long as you do your research. Okay? I'm talking about fasting for 24 hours or for 48 hours, maybe a 3-day fast. Any longer than a few days, you really do want to be under medical, proper physician supervision, directly under a physician supervision. Now, there are many complications that can happen during a fast. We're not going to go over those in detail. However, one of the many benefits of having direct supervision is for that doctor to come in and to lay his hand down on your pulse and to feel that pulse and to listen to the heartbeat directly and to check your blood pressure and to check your temperature and to check your weight and to check the oxygen saturation in your blood, to check your blood sugar. To have a physician there to check all of those parameters and make sure that everything is going as planned takes a whole lot of fear and worry out of the it makes this not a factor anymore. Fasting on your own can be it can cause worry. All right. The heart has increased. You start worrying about that. Oh, you're nauseous. You start worrying about that. Oh, my blood pressure is a little elevated. You start worrying about that. Maybe your blood pressure is lower. And this accumulation of worry because of the changes that are happening, that does not constitute a restful environment. So we are trying to maintain a completely restful, peaceful environment while fasting. And without an experienced physician there to take your pulse and to check all the vitals and all the parameters and to look at your blood and to check your blood once a week, without a physician there to understand what those numbers mean and to understand whether there are complications or there aren't complications, having somebody, a skilled physician, come in and check that will take away a whole world of worry from your fast. And that's exactly what we want. We want a 100% pure, restful, calm environment while you're fasting in order to get the results that you want. There are many people who say that they've fasted on their own. They've done 14-day fast, they've done a 20-day fast on their own, they've done a week on their own. In reality, that's probably not a good thing to pay attention to, or put stake in people who are saying that, because you have no idea what these people are doing. lot of people say online, they're doing a 10-day fast, they're doing a 20-day fast. You really don't know what people are doing. You have no idea. They could be doing lemon juice. They could be doing coconut water. Maybe they're going out and taking walks and exercising, having moderate exercise during a fast. Maybe they're going out and driving a car, which is not only unsafe for the fasting patient, but is very unsafe for everyone else out there on the road. Right? You certainly don't want to be on the road with another car where that person has been fasting. That's very dangerous to operate any kind of heavy machinery while you're doing a fast. So don't put a lot of stake in people who are saying those types of things online or in social media. You really have no idea what's going on out there. I had another question here. Is this possible in a 9-year-old kid with Hashimoto's thyroiditis? Only water. That's kind of a hard question for me to answer. I would say in general that children, I find it that it's not necessary to fast children. Sometimes they require some intestinal rest, maybe a day or two with specific types of foods or juices or broth. It's very unlikely that it's going to be necessary to fast a child. Children have not been adulterated like the rest of us, after 20 or 30 or 40 or 50 years of life. So they do have the capacity to recover very quickly, and oftentimes it's not necessary to fast them. However, I would say in order to address the cause of the issue, a detailed history, right, appropriate physical examination, and to take a look at the laboratory tests and to order any laboratory tests that we deem are needed, any extra, maybe functional laboratory tests. The point is that what you want to do is figure out what the cause of the problem is. Yes, maybe your son has been diagnosed with Hashimoto's thyroiditis. However, first you want to take the appropriate steps and figure out what's really causing the issue before we go fasting anyone. Okay? I hope that makes sense, Joyce. And we certainly do phone consults, so if you want to find out what's really going on with your son, I suggest you set something up with us. We see that type of condition all the time. So, hello, Luz. Hola, Luz Rosario, how are you? Hola, Novina. Saludos, Rosa Aquino. Rosa, saludos. So, the next question is what symptoms will I have during a fast? Right? Everybody's a little bit fearful about the amount of symptoms or the type of symptoms that they might have during a fast. People have symptoms during fasting. This is very normal. Normal symptoms, very common symptoms, are things like nausea, headache, sometimes vomiting, although that is not typical. That does happen early on in a fast. Low back pain, body pain, headaches, sweating. Oftentimes patients get very bad breath. They have terrible body odor. They also get a kind of a bad taste in their mouth during fasting. Another common symptom is what's called orthostatic hypotension. This is where the blood pressure lowers because the amount of fluid in the bloodstream is less than is normally there. So while fasting, we go through a process called natriuresis, which is where the body kicks off a bunch of sodium and excess fluid. And so the amount of volume inside the arteries is actually a little bit less than usual. And so if you stand up too quickly or if you sit up from bed too quickly, you're going to get very lightheaded and feel like you're going to pass out. Right? The black curtain will come down over your eyes and you'll feel like you're going to fall. And this can be dangerous during a fast because patients can fall. Right? So we try to avoid doing things like taking showers, right? Standing in one position for a longer period of time, especially if there's hot water that can make it very dangerous. So we give patients a specific protocol to follow to avoid these types of complications. We want to avoid anyone falling and hitting their head and getting injured during a fast. So we give patients a specific protocol, and of course they're being directly supervised. So even if something does happen, then there's somebody there to address the situation appropriately. Nausea is very common. Headaches, low back pain, I went over all that. If you guys have any questions about those specific symptoms, please let me know. I'm going to move on to the next question. The next most popular question is how long do I need to fast? So, how long do I need to fast? Now, I know everybody out there wants to hear that they just need to fast for 24 hours. Just fast for 24 hours, and then after that, we have a special diet for you. It doesn't really work like that, okay? An average fast at our center is about 14 days, okay? That's 14 days on water with an additional, I'd say, 6 or 7 days of refeeding. So there's a period of refeeding or recovery afterward to avoid complications during the refeeding process and make sure everybody's healthy and has enough energy to go back out into the world. Let me answer this question from Carmen before I keep going. My husband has Parkinson's. Would it be good for him to fast? Short answer, yes. Many Parkinson's patients are good candidates for fasting, and that might be a thing. That might be something that you really want to consider. However, this really depends on how advanced the Parkinson's is. If this is someone who really needs a lot of help, moving around and doing things for themselves, might not be a great idea to just go right into a fast. We might need to do some good preparation in order to gain back some mobility before we go into a fast. However, yes, some neurological conditions such as Parkinson's, they can respond quite nicely to fasting. But they're really what you want to do first is get on a very, very healthy diet and clean up your diet first and prepare for at least a couple weeks to a month before you come into a fast. Having said that, I really don't know your specific case, so it's always better to get the information that we need and then design a program that really fits that patient. If we need to fast or not, we can figure that out once we have all that information. I hope that answers your question, Carmen. But things like tremors, central tremor, and Parkinson's type tremors, and other neurological conditions sometimes do respond very well to fasting. I wouldn't say they respond all the time, but many times they do. Okay. What was I talking about? Yes, how long do I need to fast? So an average fast at our center is around 14 days, plus 5, 6, 7 days for refeeding. That's around a 20 to 22 day fast. 20 to 22 day stay. Okay. Hola, chica linda, welcome. To figure out how long you really need to fast, we need to talk about what your health goals are. Okay, we need to decide what it is that you're looking for. Right? If maybe you're a diabetic, you've been on metformin and insulin for an extended period. Maybe you have high blood pressure, depending on the type of medication, how much medication, how long you've been on had high blood pressure. Short answer is that a longer fast is going to have more lasting and more profound effects. That's just the way fasting works. Everyday fasting has benefits. So doing a fast for 4 days is going to be much more beneficial than doing a fast for 2 days. Doing a fast for 14 to 20 days is going to be you're going to see much more dramatic changes in that time period than you will if you just do a fast for a week. We have some patients who do come and they do a fast for maybe 5, 6, 7 days, and they don't see a lot of dramatic changes. There certainly are changes that you can see, but they're not so dramatic. So longer fasts are going to give you the profound changes that sometimes patients are looking for and need when it comes to symptomatic relief. Okay? Also, fasting is not something that you should think about just doing one. Okay, I'm going to do this one 25-day fast, and that's going to detoxify me from my life that I've been living for 50 years, quite unhealthfully. That's not how fasting works. Okay, you've been living 40, 50, 60 years, not really living 100% healthfully, and maybe you haven't been taking the rest that you needed. Maybe you're drinking coffee and drinking alcohol and ingesting other supplements and harmful chemicals. One fast might not be enough to, number one, achieve your goals. Number two, detoxification is something that our bodies are supposed to do on a continual basis. So it isn't something that your body is going to automatically clean up in 2 to 3 weeks. That's not how fasting works. We had a question back here that I do want to address before I move on. My husband has MS. Would he do this fast? MS is an autoimmune condition which attacks the neurons in the spinal cord, and there's degeneration happening inside the spinal cord. Multiple sclerosis patients do very well fasting, depending on the type of case. Okay, so this is definitely something that you want to consider. Multiple sclerosis, as well as other degenerative autoimmune conditions, do very well fasting and with the introduction of a healthy diet and lifestyle. Many times we can see complete remission or complete absence of symptoms, and sometimes the degeneration inside the spinal cord can regenerate. The body does have the capacity to regenerate some of those neurons inside the spinal cord that have been degenerated because of the autoimmune condition. However, I don't know exactly if your husband is a good candidate for fasting. That is something that we talk about during a first visit or a phone consultation. Carmen Valentin, that's a good question. We do see quite a few patients with multiple sclerosis or other types of degenerative autoimmune conditions, and the vast majority of them do very well fasting. Okay? Part of the reason they do so well fasting, part of the reason these autoimmune conditions do so well fasting, is because the immune system is really allowed to regenerate during a fast. Your white blood cells, while you're still having an autoimmune reaction, your white blood cells are actually causing an issue. And if we can tell those white blood cells to stop and to replace themselves, then we can get a more appropriate immune response, and oftentimes the autoimmune response stops completely. But first we need to put the body into an environment where it has the capacity to regenerate the immune system. While fasting, you're basically going to take all those useless, old, non-functioning white blood cells, and you're going to get rid of them. You're going to kind of toss them into the trash, and then your bone marrow is going to be stimulated to produce new white blood cells that are not autoimmune white blood cells. They're normal, healthy white blood cells, and often they do not, as long as the repeated damage is not coming from the diet afterward, we can often maintain a very healthy body, whether we have the antibodies for the autoimmune condition or not. So we see many patients with Sjogren's disease, lupus, rheumatoid arthritis, psoriatic arthritis, and many other autoimmune conditions, as well as Hashimoto's. That's an autoimmune condition as well. These people with autoimmune conditions respond very well under fasting for many reasons, but replacing the white blood cells and upgrading the immune system is one of the reasons that fasting patients do so well. Hello, Yasmin. Hello, Nicole. How are you? So what we were talking about before is how long should I fast? fast. Many patients do require more than one fast in order to achieve the goals that they're looking for. Right? Many times, if you do have a honest to goodness condition, let's say diabetes or high blood pressure, that you're really trying to get out from under, then you might require either a longer fast or maybe 2 fasts within a year or 6 months. It does take some recovery time in between fasts, 3 to 6 months recovery, and then come in and do another fast. Having said that, for a healthy person, I consider myself a healthy person. I try to live very healthily, and I've been practicing that for about 8 or 9 years. But I do fast every year. Okay, fasting is something that actually is probably more beneficial for a healthy person to do on an annual basis. I fast every year, maybe for 5 days, 5 to 10 days sometimes. This year I'll be doing a fast out in Ohio with Dr. Gracie Yuen. She has a center out in West Farmington, Ohio, called Dr. Gracie's Wellness Center, and I'm going to be going there for a fast sometime in October or November after our hurricane season, to make sure that everything is okay here, and then go and rest for a couple weeks. So, right, we're talking about how long do I need to fast. What you should remember is the greater time fasting, the greater benefits, the more dramatic change that you're going to experience. Okay. Now, many people will say something like, well, I'm healthy, right? I'm really healthy. How long do I really need to fast if I'm a healthy person? Well, what does that really mean? Like, what do we mean when we say that I'm a healthy person? Do we mean that, we don't have any abnormally high results on our blood tests, right? Just because we don't have diabetes yet doesn't mean that we're optimally healthy. Just because we, aren't taking blood pressure medication yet doesn't mean that we're optimally healthy. So we should probably be asking ourselves some different questions. Yasmin, asthma is can be autoimmune in origin as well. It's a type of allergic reaction where the muscles inside the throat spasm. And asthmatic patients do great while fasting, fantastic. And if it's child, well, we need to figure out what we need to do there. But we see many children with asthma, and they do fantastic. So a person with asthma should think about doing a fast. They should at least be starting to eat a very healthy diet that doesn't include animal products or milk or eggs to get those animal proteins out of the bloodstream. I hope that answers your question. The short answer, yes. A person with asthma is usually a great candidate for a fast. So in order to figure out if we're really a healthy person, let me answer this question before I go, because I'm going to forget it. Can a person with fatty liver benefit from a fast, and is there a way to correct a fatty liver? The short answer is yes, absolutely. A person with fatty liver can benefit dramatically from doing a fast. They have fatty liver, right, from excessive alcohol consumption, excess in eating processed oils and animal products mainly, as well as salt and refined carbohydrates. So taking a rest from that oncoming barrage of toxic materials is probably going to benefit them greatly. We do see many patients that have fatty liver that come in and do a fast, bring the liver enzymes back down to normal, and you can regenerate some of the unhealthy liver material, unhealthy liver tissue, I should say. So that's someone that absolutely can benefit from doing a fast. That's a great question. In general, the organs rest. Okay, we rest the digestive system. The liver and the pancreas get to rest. The heart and the lungs also get to. There's a systemic rest that is happening, and if we really expect to make dramatic improvements or positive changes, or reverse a type of whatever type of condition, rest is a key factor. A key factor, and that is why the controlled environment at our center is fantastic, because it's a controlled environment. Because people actually do get to rest, right? You don't get to drag your life from beforehand to a fast. You leave your work at home, and you leave your children there, and your responsibilities and your title and all your achievements and all your problems. None of that comes with you to a fast, and you actually get to rest. Fasting, one of the reasons fasting works is because we are resting. And if we have any sort of moderate activity during a fast, it does change the physiology. You're not going to see the benefits that you would if you were in an environment of pure rest. Fatty liver, the short answer is yes, absolutely. So when we're talking about whether we are healthy or not, right? Again, I do see a lot of patients that come in and say, well, I'm healthy. Why should I need to fast? I'm a healthy person. Or maybe I don't need to fast that long. I'm a healthy person. We should be asking ourselves questions like, number one, do I use alcohol? How often do I use alcohol? How often do I drink caffeine? Am I drinking a cup of caffeine every day? That's 365 cups of coffee every year. 2 alcoholic drinks a week, that's over 100 alcoholic beverages a year. You should be asking yourself, do I smoke marijuana? Do I smoke cigarettes? How about, do I have a healthy weight? Right? Am I really at an ideal weight? Or some other questions. Or do I have energy? Like, do I have a significant amount of energy throughout the day? Do I need to take a stimulant, drink coffee, eat a meal that's has some stimulants in it, in order to have energy throughout the day? Or another question is, when I don't eat for a few hours, do I feel dizziness, and am I sweating, and does my blood pressure go down? Do I have symptoms of hypoglycemia? That's another question to ask yourself if you really think that you're a healthy person. What about how I look, right? How do I look? Do I look healthy? Does my skin have a nice, healthy, pink or orange or a glow to it? Healthy people, their skin tends to glow. Okay, so we can often tell who's eating a really healthy diet and who's not eating a really healthy diet based on how the skin looks. Maybe you don't have clear skin. Maybe you have some acne or psoriasis, or you have some blemishes. Often that is caused by stress, lack of sleep, poor diet, things like that. How about how vigorous you feel? When you wake up in the morning, how good do you really feel in the morning? Do you have lots of energy? Do you jump out of bed like my 6-year-old boy does? When he gets up in the morning, it's like boom, he jumps out of bed, he hits the floor, and he's off, right? And when I sleep enough, and when I eat a healthy diet, which I have spent a long time practicing, every morning I wake up, I have that energy. I bounce out of bed, and my day begins like immediately with vigorous, vibrant energy. So, more questions you can ask yourself are things like, are my muscles toned? Do I have tone in my muscles? Right? Can I see the veins? Can you see the veins in your arm? Do they look toned? Or is there some, extra? Do you have extra tissue on your body? Do you have extra tissues that your body's holding on to? You want to be lean and mean. Less of yourself is a better self. What else? How about how often you go to the bathroom, right? Do I go to the bathroom at least twice a day? Do I evacuate, at least once, hopefully twice a day? If you're not doing that, you're probably not going to the bathroom enough, and you're probably lacking in some areas of your health. How's my breathing? Do I wake up, am I congested in the morning? Do I have this sinusitis in the morning that I always blame on the dust, right? The dust from the Sahara. That's what they say in Puerto Rico, that the Sahara dust flies to Puerto Rico. And yet some people have sinusitis, and other people don't. For example, I breathe perfectly fine, yet I'm in the same environment as everybody else but most everyone else has this congestion, this sinusitis going on. My guess is it's probably not the Sahara dust. You're probably just not as healthy as you could be. So, I'll move on. There's no questions, right? I haven't been getting a lot of questions. Hello, Alejandra Perez Renaud. Welcome. You're welcome, Yasmin. Okay, I'm going to move on. And we're about, I've been on here a while, so I do have some work to do. So I'm going to answer this one more question, and then we're going to be done for the day, okay? Again, if you guys have more questions, please let me know, or write them down in the comments below, and give me a thumbs up if you guys like this video. Give me some thumbs up, because if I don't get enough thumbs up, then I don't have a lot of motivation to keep doing this free for you guys on Monday. Okay, yeah, the last question was really, can I fast on my own? And I really kind of answered that. Yes, thank you guys. Fantastic. I saw them. Yeah, you can continue to do that. That's perfectly okay. So the last question was really, can I fast on my own? And my best advice is perfectly okay for a healthy person who's not on medication and doesn't have a specific condition that they're trying to address. Perfectly healthy thing for you to fast for a day or two, maybe 3 days. But really, after 3 days, you really want that direct supervision for a skilled physician who has experience in water-only fasting to come in and to lay his hand down on the pulse, to check the laboratory tests, to check the urine, to check the weight, to check the blood pressure, and check how all the vitals are doing in order to remain safe. Thank you guys so much, and if there are any other questions, let me know. Otherwise, we will see you next week. Okay, bye-bye, everybody.